Welcome back to the CNBC Africa special entitled South Africa's Healthcare Under the Knife. The National Health Insurance Plan is one that's been on the table for some time now, but it's only recently that real moves towards getting a concrete document have been made. But will this plan really deal with some of the fundamental challenges faced by the medical aid schemes, service providers and regulators? It's not yet clear as to how the NHI will actually work. But as the first step, the Ministry of Health has put together a ministerial advisory committee made up of industry stakeholders who are reviewing the document. We've established that private sector players are in talks with the ministry, some as individuals like Discovery Health and Metropolitan through its GEMS business, and others through associations like the Board of Healthcare Funders. Most of the private medical scheme players say they're happy with the direction the plan is going. But critics say implementing a comprehensive medical aid for all South Africans is virtually impossible. Then there's the question as to whether the country can actually afford the plan. Original proposals by the ANC suggest the plan could cost around 100 billion rand a year. But more recent research done by consultancy group Econex shows government could have to come up with an extra 220 billion rand a year. That's over and above the money it already spends on public health, which currently accounts for 4% of the country's GDP. Something which analysts say the country simply can't afford.
Firstly, there's the issue of even believing that you could just tax 100 billion rand and get away with it. There is, secondly, the problem of actually creating an institutional model that requires far more than 100 billion rand in order to be vaguely functional. And really the worrying part of the sort of proposals is the incredible naivety that underpins the view that you can actually do this and that it's actually a reasonable plan. It's not reasonable at all. Part of the problem as well is that we already have a universal free healthcare system, which you don't have to enroll for, which is paid for by taxes and will continue to be paid for by taxes. And any new money coming to the system will just be additional taxes used to fund that system. The institutional model itself makes very little sense to transform it, to get extra money. You don't need to change the whole institutional model to get extra money, but there is a limit to how much extra, realistically, the country is actually going to allocate to healthcare.
South Africa has a massive shortage of doctors and specialists, nurses and other resources. Based on current costing estimates, it seems like the NHI is either planning to fail or failing to plan.
There's not enough capacity. Like I said, if you build a house, you are not building it because you've got furniture. You now buy furniture because you've got a house. NHI is a plan. It's not an implementation. We know that as we plan, there's not enough money. We do not have enough capacity. We do not have enough doctors, human resources put that way. We do not have enough equipment. We may not even have enough facilities. But you must plan a situation that says, but if I want to cover all the citizens of this country, what do I need? You will only know what you need when you know how much responsibility you have.
Despite the challenges of costs and capacity, the private sector players we spoke to seem confident that whatever happens, there needs to be a system overhaul, and the private sector needs to be integrally involved.
There is no doubt that the current state of the healthcare system is not sustainable and needs reform. The fact is that you've got this massive disparity between public and private. You've got a public system that no matter how you measure it, is not meeting the needs of many South Africans. You've got people that just don't have access to healthcare, and that's not acceptable. It has to change. But I think what has happened that I think is important is I think we're starting to realize no matter what we think, we don't have the resources required to offer incredibly rich, complex healthcare to every single South African. We just can't do that. If you look at the numbers, were we to provide a health system for every South African like the UK NHS, that would be half our economy it would cost. So, I think the embryo of the NHI when it started being debated was very kind of ideological, and people using the public system felt the private sector had to stop. People in the private sector were arguing the opposite, the public sector was mismanaged. The reality is, I think what's coming is that you need the both to work together.
Whether or not the NHI comes into being or perhaps another plan is developed, there are some fundamental issues impacting the growth of the medical aid industry. The thing is, healthcare is tricky. Human lives aren't a normal commodity. At the same time, private healthcare in South Africa is big business and needs to be regulated to protect the consumer. In 2004, the Competition Commission ruled against the then standard practice of collective bargaining between medical schemes, hospitals and doctors. This meant individual healthcare companies would then have to negotiate with service providers. For bigger companies like Discovery and Metropolitan, their size meant better bargaining power. Now the Ministry of Health is changing its tune to look at possibly reinstating the collective bargaining system. The Council of Medical Schemes, which is the industry regulator, explains.
We're dealing with a large case of market failure. Market failure commonly occurs in healthcare environment. It is a well-known, internationally known phenomenon, and internationally there has been a response to this to market failure. First of all, one needs to introduce measures to deal with the oligopolistic situation. We have only 3 major hospital groups representing 80% of hospital beds. That gives them very strong market power, which is very difficult to counter. We've made submissions to the Department of Health suggesting a bargaining council that would serve as a proper counter to this market failure. This process obviously will take time to settle because it requires a public consultation process, the drafting of a white paper, eventually going into legislation. But in the meantime, earlier this year, the Minister asked us for proposals, and we've made a proposal to the Department of Health on a temporary exemption from competition regulation so that there could be a public authority that on a temporary basis, as an immediate quick fix, set up such a negotiation process.
But will this ruling really have a role in giving smaller schemes a fighting chance in gaining more market share from the likes of Discovery?
Understand firstly the medical scheme, the Discovery Medical Scheme, is a separate legal entity. So its profitability, in other words, if it gets discounts or whatever, that's for members. We get an administration fee, so it wouldn't affect our profitability. But would it affect the overall system's competitiveness? I don't think so. I don't think the differences are so stark that that's the issue. I think the issue of our sort of dominant mass and how we've kind of, how can I say, worked with the healthcare system gives us a very, very different competitive frontier.